We all know the drill: brush, floss, and see your dentist regularly. But what happens when something seems off? What if there's a red spot in your mouth that just doesn't seem right? We're talking about a condition called oral erythroplakia, and it's not something to ignore. Think of it as a warning sign from your body, a red flag that needs immediate attention. This is especially true with oral erythroplakia, which has the potential to develop into something much more serious: oral cancer. Knowledge is power, and understanding this condition is the first step towards protecting yourself. Okay, so we know erythroplakia is a red flag. But how do you know if that red spot in your mouth is actually something to worry about? Let's break it down. Erythroplakia typically appears as a red patch or plaque inside your mouth. It can be anywhere: your gums, the inside of your cheeks, your tongue, even the roof of your mouth. What makes it different from other mouth sores is that it's usually smooth, sometimes velvety, and doesn't go away on its own. It can be flat or slightly raised, and you might not even notice it unless you're looking closely. Now, a single red spot doesn't automatically mean you have erythroplakia. But if you notice anything that fits the description and it lasts for more than 2 weeks, it's time to call your dentist or doctor. They can examine it properly and determine the cause. The sooner you catch any potential problems, the better the chances of successful treatment and a positive outcome. Alright, so you've found a suspicious patch in your mouth and wisely decided to get it checked out. What happens next? Your dentist or doctor will start by asking about your medical history and any habits like smoking or drinking, which can increase your risk. They'll then examine the affected area, looking for those telltale signs of erythroplakia we talked about. But visual inspection alone isn't enough for a definitive diagnosis. To confirm whether it's erythroplakia or something else, they'll likely recommend a biopsy. This involves taking a small tissue sample from the lesion and sending it off to a lab for analysis. Don't worry, it sounds scarier than it is. A little pinch, and you're one step closer to knowing what's going on. Once the diagnosis is confirmed, your doctor will discuss the best course of treatment. This often involves removing the lesion completely, either surgically or with lasers. After the procedure, you'll need regular follow-up appointments to monitor the area and make sure everything is healing properly. Vigilance is key when it comes to oral health. We've talked about erythroplakia, its risks, and how it's diagnosed and treated. Now, let's talk about why you should care. Early detection. Imagine you're playing a video game, right? You wouldn't wait until you're down to your last life to start taking things seriously. You'd want to catch those power-ups, dodge those obstacles, and stay ahead of the game. It's the same with your health, especially when it comes to something like erythroplakia, which has the potential to become more serious. Early detection is like that power-up, that extra life that gives you an advantage. The earlier erythroplakia is found, the easier it is to treat and the better the chances of a positive outcome. Think about it this way: catching erythroplakia early is like tackling a small fire before it becomes a raging inferno. Early detection allows for less invasive treatments, faster recovery, and a lower risk of complications down the line. We all know the drill: brush twice a day, floss regularly, and try to resist those sugary treats. Okay, maybe just one. But there's another crucial part of maintaining good oral health that many of us tend to overlook: regular dental checkups. It's easy to think, my teeth feel fine, why bother? But trust me, those visits are about so much more than just checking for cavities. Think of your dentist as your oral health detective. They're trained to spot subtle changes in your mouth that you might not even notice, including those early signs of erythroplakia. They have the tools, the knowledge, and the expertise to catch potential problems early on when they're easiest to treat. Regular dental cleanings are equally important. They remove plaque and tartar buildup, which can irritate your gums and increase your risk of various oral health issues, including erythroplakia. So, make those appointments and stick to them. We've covered a lot of ground here, from what erythroplakia is to why early detection is so important. But knowledge without action is like a car without an engine. It's not going to get you very far. So what can you do to stay ahead of the game and protect your oral health? First and foremost, be proactive. Get familiar with your mouth. Take a good look around every now and then, checking for any unusual changes. If you notice anything that concerns you, don't hesitate to contact your dentist or doctor. It's always better to err on the side of caution. Next, make healthy choices. By making positive lifestyle changes, you're not just reducing your risk of erythroplakia, you're improving your overall health and well-being. The more you know about oral health, the better equipped you are to make informed decisions and take charge of your own well-being. So stay informed, stay curious, and never hesitate to ask your dentist or doctor any questions you may have. Oral leukoplakia is a white patch or plaque that develops in the mouth. It is often associated with tobacco use and can be a precursor to oral cancer. Early detection and treatment are crucial for preventing progression to malignancy. Regular dental checkups and avoiding risk factors like smoking can help in managing this condition. By staying vigilant and making healthier choices, you can significantly reduce your risk of developing serious oral health issues. Remember, your mouth is a window to your overall health, so take good care of it. Thank you for watching and take care of your smile. Stay informed and proactive about your oral health to catch any issues early. Regular visits to your dentist can make a significant difference in your oral health journey.